change the slides as we go along. So welcome. Welcome, everyone. Okay, so good evening, everyone. Welcome. Thank you for being here tonight. I know there's lots going on in community, so it's great to have everyone here to learn a little bit more about some of the work that I've been working on, as well as the Nova Scotia Health Authority, Health Association of African Canadians, the IWK and ANSA, who kind of came together to begin the work of the African Nova Scotian Health Strategy. So first of all, I'd like to introduce myself. So my name is Rhonda Atwell, and I am, a little bit about me is that I've been a member of the Preston Township, my family, for 7 generations. I live in East Preston. I'm also the African Nova Scotian Service Consultant with Nova Scotia Health Authority. Nova Scotia Health, sorry, the authority's been taken out of it. And I'm also a board member of the Health Association of African Canadians and have been for many years now. So before I begin, I just wanted to acknowledge that we are in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. I would also like to affirm that we are in the decade for people of African descent and that African Nova Scotians are distinct founding people who have been a key part of Nova Scotian culture and history. I also want to take some time, a moment of silence, if we can, as we've been impacted in Preston Township by the recent violent and untimely death of a young member of the community, Quintez Downey. May he rest in peace. Our sincere condolences, love, and prayers go out to the family during this very difficult time. And I just want to hold a moment of silence in his name. Okay, thank you, everyone. So I'm going to begin the presentation now. Carla, if you can go to the next slide, please. Okay, so what is the African Nova Scotian Health Strategy? Maybe some of you have heard, or all of you have heard about it, but I just want to talk a little bit about the history and where we're at and where we're going with the strategy. So the African Nova Scotian Health Strategy was created to hold conversations directly with people of African descent in Nova Scotia to hear about our experiences with the healthcare system. The purpose of the strategy was to create create equitable healthcare services and programs and to lower the level of health disparities within the community. In the beginning, and some of you may remember this because I was present at this, as well as other HAAC board members and other community members, the Nova Scotia Health held Talk About Health sessions back in 2016 with the CEO at the time, Janet Knox, in development with the Health Association of African Canadians. This conversation took place with community, where it was suggested by community to when we were asked, what do we need to support our health in the healthcare system? What do we need? And it was actually mentioned by a community member that we have a strategy, that we actually require a strategy to support Nova Scotia Health and the IWK, essentially to enhance knowledge, skills, and attitudes of staff and improve service provision to African Nova Scotians across the province. So to help achieve this request, a partnership was formed among the Health Association of African Canadians, Nova Scotia Health, the IWK, and the Department of African Nova Scotian Affairs to develop the first ever health strategy geared specifically toward African Nova Scotians and African Canadians, as African Nova Scotians are a distinct group with unique experiences and health needs. And we require a strategy that will address the existing barriers which prevent access to the healthcare system. Next slide. So why do a strategy? Essentially, the healthcare system has never met directly with people of African descent in Nova Scotia to hear about our experiences with the healthcare system. So this is the first time, like I said. Even though we know anecdotally that there are health disparities in the community and people's stories inform us, um, we actually don't have enough data. There's some things that are happening in Nova Scotia, researchers, Black researchers who are doing some work in community, but essentially we really don't know. We need more. We know that racism has been identified as a social determinant of health, and its impacts are longstanding. We don't know what diseases are specifically prevalent in the community because we don't have local health data. We often use American data, which doesn't necessarily speak to the unique needs of African Nova Scotians and African Canadians. Next slide. So the purpose of the African Nova Scotian Health Strategy is to create equitable healthcare services and programs and to lower the level of health disparities within the community. The goals to create culturally appropriate strategies to address health inequities and injustices, to build and strengthen relationships and partnerships, and to influence and advocate for the use of race and ethnicity identifiers and data collection in a safe and culturally responsive way. Next slide. So to date, 17 different Black communities throughout Nova Scotia have been consulted, including Indigenous African Nova Scotians, Francophone men, the African Caribbean student body at Dalhousie University, Congolese women and youth, and the Ethiopian community have all been consulted. Discussions included the main health issues faced, the social determinants of health identified, their personal experiences with the healthcare system, as well as what could improve the overall health and well-being of African Nova Scotians. Next slide. So here are just a few of the recommendations that came out of the community consultations. Now, this is just like a theme. These are themed uh, concerns that kind of came up through all of the consultations. But currently we do have a report. It's very comprehensive. It's about 100 pages in length with all of the consultation information in there. It was analyzed by Dr. Ingrid Waldron and along with the advisory to the work. And it's currently with Nova Scotia Health, but this is essentially some of the highlights that came out consistently throughout every conversation. So essentially more African Nova Scotian representation within the healthcare system. We know we need that. Culturally competent healthcare, more educational opportunities, more employment opportunities, research and race identifiers needed, improving physical environments, health education, more interpreting services, and core funding for the Health Association of African Canadians. So, sorry, I had a little bit more to say there. Carla, thanks. So like I said, we know representation of African Nova Scotians on all levels are within the organization is key to equity, diversity, and inclusion. African Nova Scotians need to be at the leadership table. Okay, this is 2021, and we know what 2020 has brought us through. It's unveiled many injustices worldwide that will no longer be tolerated and must be addressed fully and systemically. And COVID-19 has only further highlighted the disparities that must be addressed. Specifically, the Association of Black Social Workers in Nova Scotia actually put out a statement asking for Canada to recognize that people of African descent have been living in a global pandemic for over 400 years. And the injustices of systemic racism that plagues our communities in every facet must be acknowledged and addressed now. The need for an African Nova Scotian service consultant, which is the position that I'm in, that looks after the health needs of African Nova Scotians has been a priority request from all community members consulted. This request from community has been extremely important to this work, given that the community feels over consulted. I think people have research fatigue at this point. And so a lot of what was being said at the tables that we were at was that, we don't want this to sit on the shelf. This cannot be a shelf-sitting document that goes nowhere. We want to see results. So what do we need to see that? And it was recommended that we have a position inside Nova Scotia Health that could actually speak to our needs, which is where I'm sitting at now, and I'm very grateful for that. So just to speak more to why that's really important, is that in my current role, I'm able to work with community to help kind of put pressure on the institution and senior administrators to see this important work through to fruition, right? Because we actually want to see results. It's time to see some tangible actions, and the time is definitely now. Next slide. So racism was talked about at every table. Okay, so we know that racism makes us sick. The social determinants of health are linked to the social and economic conditions and their distribution among the population that influence individual and group differences in health status. Racism has been identified as one of the 14 social determinants of health. Racism and its impacts on our community was expressed in all community consultations. We know that the impacts of racism on all levels makes us sick and can present in multiple forms. It has impacted generations of African Canadians. Many community members told their stories, and racism, both institutionally and personally mediated, has impacted the lives of our people and our families, impacting everything from education and employment to living in toxic environments. Next slide. So the theory being used in the strategy, so the report that was written, there was the theory that was being used is an anti-racism theory that maybe some of you have heard of or all of you know of. I've referenced the theory myself in my own writings and research. And it's a theory that uses an intersectional analysis. So in other words, anti-racism theory argues that race must be foregrounded or seen as salient in discussions on Black people's health, right? But that analysis must accommodate an intersectional analysis that examines how race intersects with culture, income, social class, immigrant status, gender identity, sexual orientation, disability, and other social identities that shape health and well-being. Critical race theory is also understood on this basis. It is a framework that can be used to theorize, examine, and challenge the ways race and racism implicitly and explicitly impact our social structures. So CRT is interdisciplinary and draws from and extends a broad literature base of critical theory in law, social history, ethnic studies, and women's studies. So it's a very holistic approach to this work. Next slide. So like I said before, the time is now. The time is now. Given the long historical connection to Nova Scotia, Canada, African Nova Scotians are considered a distinct cultural group. So in 2015, many of you may be familiar with the report that had gone out by the International Decade for People of African Descent, the UN report. 2015 to 2024 has been declared as the International Decade for People of African Descent. The UN document created around this work is comprehensive, and it provides an in-depth historical analysis of the social determinants of health and the lingering impact that it has on our health and wellness as African peoples in Canada. African Nova Scotians are named specifically in that document as a distinct cultural group. African descendants, as declared by the United Nations, are a priority to which they intend to prioritize and improve the appalling conditions of African Nova Scotians in Canada. They specifically stated, and I quote, "We will no longer accept socioeconomic exclusion and marginalization as an accepted way of life for African Nova Scotians." Actually, just this past September 2019, the government of Nova Scotia launched an action plan in response to the United Nations report on the International Decade for People of African Descent. The action plan is called Count Us In, It is a guiding document providing government with specific actions and priorities to eliminate the many challenges facing African Nova Scotians. It reflects work underway and creates new opportunities. Count Us In will help government departments, organizations, and community work together to advance this important work. It's important, I'm just putting things into context here in terms of where we're all moving, where we're all going, as you know, the issue of systemic racism has been the conversation at all tables, especially now more than ever. And so even the Canadian Public Health Association has recently acknowledged the impacts of racism on the health and well-being of racialized people. They state, all agencies and organizations involved in education, research, and the provision of health and social services in Canada to adopt a formal statement condemning racism. We're doing that at Nova Scotia Health now. Undertake system-wide reviews of the regulations, policies, processes, and practices to identify and remove any racist systems and approaches. Implement assessment methodologies to identify and remove racist laws, regulations, procedures, and practices. Provide mandatory, rigorous, and system-wide anti-racism, anti-oppression training for all staff and volunteers within their organizations. Enhance public health surveillance systems by collecting and analyzing race and ethnicity identifiers and data in an appropriate and sensitive manner. And monitor their organizations for stereotyping, discrimination, and racist actions, and take corrective actions. And I'll repeat that, take corrective actions. That's really important because that's where essentially the, that's where the, policy is actually, got some teeth. We want to see accountability in everything that we do. Next slide. So next steps. So there's a lot been going on this year. I started in this position as the African Nova Scotian Service Consultant in March of 2020. So you can imagine, I came into this role online during a pandemic and was very much involved in the community pandemic response. So it's been very consuming, and the strategy's it's been put on hold. Quite honestly, it's been put on hold, but we are working and pushing and working within community and within the Nova Scotia Health, within Nova Scotia Health to make sure that we don't forget what it is that we need to do and move forward on it. So the work of Dr. Ingrid Waldron, like I mentioned before, and the African Nova Scotian Health Strategy Advisory Committee compiled and analyzed what the community had to say, and a report with specific recommendations was drafted. The report is currently internal at Nova Scotia Health, and it's being vetted by the executive leadership team. Reporting back to community through re-engagement sessions also took place as part of the consultation process, to confirm that the community that we actually heard what the community had to say and that they approved, what we heard. We wanted to make sure that we heard correctly. So we did do that re-engagement. That was through HAAC and the work of our members and our board members as well. And so realizing that community engagement is a continuum and the community values that, it's really important to do that loop back to community when you're engaging. So this is part of this process, as well as updating everyone, updating you all on what is actually happening and how we're moving forward. So the pre-strategy request to hire an African Nova Scotian Health Services consultant was to ensure that the recommendations that came out of the community consultations was pushed forward and implemented, like I said. The creation of this position at Nova Scotia Health was a specific request. It's essentially the first deliverable that came out of the recommendations in the report. So moving forward, Nova Scotia Health will be supporting the creation of an advisory committee to support my work. Creating the advisory is important to moving this forward. I'm in one position that represents the whole province, and it's really important that I have an advisory to support me in pushing the recommendations forward. It's crucial to the implementation and success of the African Nova Scotian Health Strategy, and I'm hopeful that we're moving in the right direction on that. So, next slide. That's it. Thank you, everyone. It's short. I hope I've filled you in on some things. And if you have any questions, please feel free to ask, and I'll try my best to answer.
Hi, Rhonda. Celeste here for Bandiginish.
Hi, Celeste.
Nice to see you.
Oh, where are you? Wow.
Oh, I'm just in my happy place. It's called Zoom features.
That's nice.
I want to thank you. I guess that my question is there any talk to increase the number of positions to support you in doing your work?
You mean like to actual like employees to hire people?
Yeah, actually to have more than one person be responsible for the entire province. Is there any discussion about that?
There's discussion. There's definitely discussion. And like I said, I think we're moving in the right direction with starting with the advisory and then building on that. But currently, no, there's nothing that's actually taking place to make sure that happens at this point. But I am hopeful that it will come.
Okay, great. Thank you.
Thank you. If anyone else has questions, we still have a little time here. Please feel free. Don't be shy. I can't see anyone. Oh, hi.
Hi there. My name's Susan.
Hi, Susan.
I just have a question regarding, you said one of the improvements that you had identified was improving physical environments. Are you talking about buildings and where African Nova Scotians live and the quality of housing?
Well, yeah, so I mean that could be included as well, but I mean essentially, so I live in the Preston Township, okay, for example, and at some of our, the consultations that we had in community in the Preston Township, there were concerns around, building infrastructure within the community, essentially like, healthy living options as well. So for example, we don't have sidewalks. It's a huge concern, right? So walkability is very constrained. It's actually not safe, right? Lowering, how fast people drive, lowering the, why can't I think of the word?
Speed limit?
Speed limit. Yes, sorry. Lowering the speed limit so that we can feel safe walking with our families. Currently, it's, you literally see families walking on the road, on the highway, essentially, with children in their hands. So having things like sidewalks, having access to healthy foods. We don't have, local supermarkets or grocery available to us. We have to leave the community to find those things. And if people don't have access to transportation, that can be very challenging, right? So that, yeah, that, I don't know if that answers your question, but we have health promoters in Nova Scotia Health as well, who I know help to advocate for some of these things, but we need more. We need more advocacy and resources to go into it.
Rhonda, you have a couple questions in the chat.
Okay. Thank you. Hi, Rhonda. Is there a way we can access the African Nova Scotia Health Strategy document? And this is Courtney Brown. So Courtney, I don't know if you work for Nova Scotia Health. Forgive me if you do and I don't remember. But it is currently an internal document only. So it's available to employees, but that's really it at this time. But the plan is to for it to go through the vetting process within the executive leadership team and be available to community, because it needs to be launched and recognized as well. So that's part of the plan. I don't know if I answered your question. If I didn't, let me know and I'll try to find you more answers. Will the advisory, so Celeste is asking, will the advisory committee have reps from all over the province? That would be good if the advisory did. I think that's important because we're limited with the amount of people we're going to have on the advisory. I'm not exactly sure how wide that will extend, but that, yes, that is something that we're looking at.
And Rhonda, Rachel had her camera on before Joanna's question came in.
Sorry?
I don't know if Rachel, do you want to ask a question?
No, I just put on my camera so she'd see,
okay, never
so
mind.
she'd see a friendly face. I just like to show a friendly face.
How you doing?
I'm doing good. You did really well.
Yes. Oh, thank you so much. Yes. So Rachel is my colleague at Nova Scotia Health. She's an equity consultant in the Eastern Zone, Western Zone, Western Zone, Rachel. Sorry. We have equity consultants all over. So I'm glad you're here. Hi, Joanne. Did you have a question? Oh, you do. It's right there in the chat. Do you want to ask it?
Sure. I'd like to hear more about what's being done around economic determinants of health for African Nova Scotians.
Do you want to be more specific, please?
For example, like access to employment or access to financing to start businesses and entrepreneurial activities.
Right. Okay. So that's a good question. I know that there was just a launch of the Road to Economic Prosperity, that that report and that work that has been done with the Greater Halifax Partnership. I mean, that's all part of this too, in terms of addressing, economics as a health determinant. We know that it is. So hence employment, the need for employment, and increasing access to education, employment. I mean, all of these things were discussed. So yeah, I mean, it's part of the strategy as well, but it's not clearly defined in with regards to how you're describing it. It's not clearly defined that way, but the social determinants of health are at the foundation of all of that work. I don't know if I'm making sense.
Yeah, that makes sense.
Yeah, and remember, it's a fluid document as well, so it's not going to remain the same. I mean, as things change within Nova Scotia and within the healthcare system, we could see the direction, not necessarily the direction changing with recommendations, but more things coming in as we discover where we're going with this. So, and Celeste also has a question. Have you specific suggestions on how can those of us that work in Nova Scotia Health can support my work? Be available, I guess, as much as possible. I mean, just say the fact that you're open. A lot of people have come forward asking, how can we be a part of this, including like the community health boards who want to be involved in this work. Like I said, it's important that we have allyship, we have advocacy, that you're bold, in representing, in addressing systemic racism, specifically anti-Black racism, that you're actually intentional about helping us move forward. So when it comes to things like employment equity, for example, which we know we need to work on, that you're behind some of the actions that are taking place, that you're behind the employment equity policy, making sure that we have a good employment equity policy that has teeth, and putting the pressure on, letting us know what your teams look like. Managers and directors will even reach out to me sometimes and say, I want to see more diversity in our teams, and we need more help with this. So in any way that you can help, in those ways, in supporting the strategy work, is important. It's important to know that you're there. There's another question. Robert Duvet, sorry, just one second. Is the internal review of the report ongoing, or has it been paused because of the pandemic? Good question, Robert. I would say that it is both. I don't know if that's possible to say, but that's my, so what I'll say is that it has been put on pause. The COVID response, the pandemic response has been a priority. Marginalized communities have been most impacted. So we know that, our focus has been deterred all throughout the community as well. So the system is reflective of that. But at the same time, while we're responding during the pandemic, we're also noticing the gaps in services, the gaps in programs, where we see more and more that we need to ramp up and amp up this work, and that, you know, we need to have these conversations pretty much at every table throughout the organization. We're currently working on, we work together. We're currently working on an anti-racism statement within the organization. So while even though that, you know, that was not necessarily specifically listed in the strategy, it is essentially part of building the foundation around that work. You know, making sure that we have a good foundation when we're actually going to get some of this work done. So an anti-racism statement, an anti-racism policy, these are some of the things that you know, the leadership is committed to, and those of us who are working in equity, specifically equity, diversity, inclusion work, are working on some of those things. Again, I don't know if that fully answers your question, but yeah. So yeah, it's been slow. It's been slow, but we're getting there. Any other questions? These are all really good questions. Like, again, like I said, I don't know if I fully answered, but thank you, Dr. David. So if that is all, I don't know, but thank you, Courtney. If that is all, this wasn't intended to be a long presentation. I know that there's other members, HAAC members, who have other priorities. So you learned a lot. Wonderful. There's more to come as well, just so you're all aware. There's more to come, and we will keep you updated as we go along. So thank you for joining me this evening. Thank you, everyone. Have a good night.
Thank you, Miss Rhonda.
Thank you. Thank you, Carla.
You're welcome.
Thank you, Rhonda. It's Sharon. Great job.
Thank you, Sharon.
Yeah.
I'll see you guys soon.
Nice to see you, Joanna.
Great to hear your voice as always, Carla.
You too.
Miss you.
Likewise. Okay, bye, guys.
Bye.